I'm Dr. Michael Detola.
And I'm Megan Strong.
In this week's episode, a dentist gets a little chintzy with the syringe material and now is going to have to take a really expensive second impression.
And attention residents of British Columbia, don't be wooed by this dentist's low prices. Let's just say his clinic doesn't pass code.
And you're going to find out this week why Megan's ancestors probably did not subscribe to Cat Fancy magazine. That and more on today's Chairside Live. Now, hello and welcome to episode 64 of Chairside Live. 64. Megan, what is that number? It's ringing a bell for me, but I can't quite put my finger on it.
The number of cats my grandpa drowned?
No,
Okay.
It wasn't. No, that's a sad story and probably a very low estimate. But
Sure.
And I'm sure it was other species besides cats, knowing all the animals that they had.
I'm sorry.
It was the year I was born.
Oh, congratulations.
Yeah, thank you
You're
very
on.
much for being old. Appreciate that. How you doing today?
I'm doing well. I feel a little off balance because I forgot my mug at home. It was in the dishwasher.
Oh, really?
And so I don't have, because I actually clean my mug. I won't say who doesn't, but his name starts with Michael Detola.
These mugs aren't that nice.
Yeah, they are.
No, you put these in the dishwasher and all the mercury and lead just comes right out. And
perfect.
you're going to have a whole mouthful of that. We'll put it in the middle, we'll share.
Nice. And besides that, I'm feeling a little embarrassed because if you see, I don't know if you can get, I've got some tiger claw marks.
Wow.
Yes.
Tiger, of course, the nickname for your husband?
No, this is uncomfortable. No, actually, Parker.
Your dog.
My dog, Parker. We were playing around and I was teaching him tricks and he jumped up and got too excited and mauled me.
Wow. Did you report it to the authorities?
No.
Okay, well, I had noticed that when you walked in, and I don't think it looks very good on screen. And frankly, it's an open wound, and our insurance policy does not allow to be. It's an open wound. It's weeping.
It's a scab. That's disgusting. It's totally scabbed over.
Isn't weeping like a disgusting way to describe a wound?
Oh, beyond.
It's kind of like
You think this is going to look better?
I know it will. One of the things in dental school that's really disgusting is when they talk about ropey saliva. When you take a...
Excuse me. Oh, you're going to put it on.
Yeah,
Thanks.
put it on. There you go.
Well, that'll feel good coming off. Oh,
All right,
wow.
there we go.
It's not even...
Awesome. All right, now I feel like we're set.
We are.
Now I don't worry about if I accidentally spit, germs landing on there and you getting infected.
Ew. Oh.
Or that fruit fly that's been buzzing around the set for the last 6 or 7 weeks.
They just won't die.
That thing, yeah.
If anybody has advice for how to kill or trap fruit flies, please email us
I actually know
at
how.
Chairside Live.
Do you know how?
How?
You take a bowl and you put some fruit that's starting to spoil there,
Okay.
and you put saran wrap over it and then poke holes in it with a toothpick. And much like the Roach Motel, they check in and they can't check out.
Oh my gosh.
And it
And
actually
Hotel
works.
California.
Exactly, and it actually works. We used to have fruit fly problems at the house when we used to buy organic fruit.
Yeah.
Now I'm 100% pesticides. Love it, because you never see those anymore. All right, well, we've got an interesting show for you today, as if that weren't interesting enough. We've got a case of the week for you that I think you're going to like. I understand dentists wanting to cut costs and keep their overhead low, but I want to share an impression with you where I just don't think we can cut this many corners and use a hummingbird's beak full of syringe material on the inside of an impression. This is an impression for a Bruxer bridge, and you'll see what happened when the doctor really cheaped out on the amount of impression material used. In fact, let's go ahead and take a look at that now. I was walking through the Bruxer department the other day and saw a articulator that was sitting here and noticed something on it that I wanted to make sure. I wanted to show you that we really pointed out to each other and wanted to make sure it was something that you yourself would look for, or maybe your assistant would look for when you get a case back from us. So we've got a Bruxer bridge here going from tooth number 18 to tooth number 20 with a ponic here for tooth number 19. And one of the first things that our technicians noticed when they put the case together was that there was not quite enough room between number 20 and the opposing tooth. And because of the fact that this is a CAD/CAM product, well, actually nearly all of our products now, we take this model and we scan it. And so once this is poured, since this did not come in as a digital impression, it came as a polyvinyl impression. We pour it, and then we scan it, and then we take the posing, and we scan that, and then we scan the bite of the two together, and then the software tells us how much room we have. And in this case, we didn't have enough room according to the software, and then it was verified when we looked at it visually. So you'll notice there's a big sticker here that says adjust opposing marked in black, and it's also on the in-house lab sheet that we use. as well, where it says adjust opposing mark in black. So everybody knows that when this ships, there has to be a sticker on the box with the Bruxer bridge in it that says adjust opposing marked in black. Now, sometimes if it's on the preparation, it'll be a reduction coping. You've seen different reduction copings that we do. Some of them are thermoformed. My favorite ones are metal. Those are a little more expensive to fabricate. I can deal with the stiffer thermoformed ones. But in the case of something like that, we'll have a reduction coping that fits over this molar, and then typically there'll be a cutout, say on one cuss tip, where the cuss tip will be sticking out of the reduction coping, and we just want to take the burr back and forth and reduce that cuss tip down to the level of the reduction coping. I tend to do it with a football-shaped diamond, like a 379-023 diamond, named because it's shaped like a football. And the thing I like about the football is that because of the fact that it's convex, kind of like the surface of the Explorer here, when I hold this down against the tooth and cut through the reduction coping by reducing the cuss tip like we are over here, because of the shape of this, I actually get a little bonus reduction, if you will, whereas you can imagine if I used a burr that was just a straight taper burr like this and held it to reduce this cuss tip down to the reduction coping, we would get enough reduction, but I like the fact that I get an extra tenth or two with a football fur because of the convexity that we see here. So again, you're just buying yourself just a little more space when you do that. And so anytime you receive something from us where you have the adjust opposing mark in black, without a reduction coping, it's usually just going to be something like this. And again, our technicians will do this with a straight tapered diamond. And I have talked to them many times, countless times, about, hey guys, this stone model, I know it's really easy to go in and adjust this, but guess what? In the patient's mouth, this is an actual tooth, this is actual enamel, this is precious tooth structure. We want to reduce as little as possible. And the best way to teach technicians this is to get them in the chair, and when you do a crown on them and they go to adjust their opposing and they reach out and grab your arm and say, no, in slow motion like in the movies, because they don't want their opposing, maybe it's a natural tooth ground on like this. It's a little different if it's a crown, or a little different if it's amalgam or something like that. So I caution them, please be very conservative when you come in and adjust this opposing dentition. So you can see that's a pretty small circle here. If you look at it, it's not like we have a huge flat spot that wasn't there before. It was just kind of pointy. In fact, when I do this on a patient, I don't say I'm going to go in and reduce your opposing. I say, you know what, the technician noticed when we scanned your case in the computer alerted us about a little sharp, what's called a cuss tip, a sharp point on the tooth there. And to make sure we don't break your new crown, I'm just going to go in and round that off a little bit, just kind of polish it a little bit so it's not as sharp against that new crown. And that always sounds better to me than saying, I'm going to take a coarse diamond football burr and at 40,000 RPMs, I'm going to come amputate part of the enamel here because I didn't take enough. So I just say I'm going to recontour that sharp point that the technician found or the computer found there. And again, rather than using a straight taper burr, for me, this is a good reason to use, again, a convex football burr to just go in and get a little bonus reduction as we go in and remove that little spot right in that area. We really don't need the use probably of a reduction coping here. It'd be difficult to do because the reduction coping wouldn't fit on here. Reduction copings fit well on preps because the interproximal contacts are broken. Here it wouldn't really go down, wouldn't really fit, but you can just eyeball this and just take a football diamond and spot it a couple times. You could use a fine grit diamond like a red stripe. You could even use something out of the Bruxer adjustment kit with the blue stripe on it and go in and because that's a very fine diamond, and just hit it a few times, and then it'd be very easy to polish afterwards. And of course, when you put the bridge in and had the patient bite together, you'd be able to identify with the articulating paper whether or not you had removed enough. So when we look at it now, you can kind of see that black spot that's there, and again, we have our minimum 0.6 of a millimeter reduction. That might be a little more. That could be 0.8, maybe up to a millimeter here. And again, we've talked about these Bruxer bridges before on this show. I would not fault any dentist who wanted to do a PFM bridge here. In fact, I would consider doing a PFM bridge here myself because it does go back to a second molar. In fact, I'll just come right out and say it. I would have done a PFM bridge here. I just don't think that having metal margins showing down here is that big of a deal, unless this was a patient who said, hey, no metal, I'm allergic to every metal found on the planet, I use plastic forks and spoons at home. That's how allergic to metal I am. In fact, don't touch me after you've touched that articulator. I will break out in hives. Unless they say something like that, I'm going to go with a PFM bridge here instead of a Bruxer bridge because there still is a chance this bridge can fracture. It's still an all-ceramic restoration. That's really not even the point of what I wanted to show you of this. It was the impression itself. As we pull out a little bit and look at the impression, this is what we got from the doctor. So it's a full arch tray. That's nice. I like metal trays, but if I try to squeeze this plastic one, I'm squeezing pretty hard and I'm really not getting any movement. So it's a nice stiff tray, so we can't complain about that. But we can complain a little bit about the impression itself. We've got our one material that's been used here as kind of a pre-impression, and then we have the yellow that looks like it was done separately. You know, you've seen me many times go in and kind of peel this apart. You can always tell when looking at these impressions whether or not these two materials set at the same time. And it's something we've harped on before because it peels apart and it just never is as homogeneous as it would be if these two materials set at the same time. So we can be a little critical. This tore off actually when it was poured. If you look at the model on the lingual of that molar, you can see it is in fact actually here. So that thin little fin of material came off when it was poured. But you can see from the outside that we still have kind of a weak impression here because we don't have any of that tray material to the outside of this. But really the thing that caught my eye was the fact that there's nothing in between here. And so you can tell the pink material was taken first as an impression, and then after the preps, a little wash material was squirted on the two preps. But it was such little wash material that we really don't even pick up the ridge in between here. And that's kind of the bigger issue. Well, there's several issues here, but one of the issues is we don't have this yellow material contiguous between these two preps. And so as a result, when we make this Bruxer bridge, the bridge is going to be high and dry away from the tissue and could very easily pack a lot of food underneath it because we don't have a registration of what that ridge actually looks like. And that's one of the reasons why we're going to have to send this back to the doctor and ask for another impression, because we're going to end up really high and dry here. But you can also see that without that material supporting it on the outside, it'd be pretty easy to get some sort of deformation here where it may not fit. I mean, technically, this is actually almost kind of outside of the tray itself when you look at this impression. But what would we have liked to see? Well, you probably know. You know as well as I do, we like that simultaneous impression where these both set at the same time. And I always will take this syringe material and squirt it around here and this prep and then in between it as well. If my assistant hasn't handed me the tray yet, I'll even start putting some on the incisal edges of the other teeth just to cover those as well. But even if you just squirted it here and here, even if you really didn't get any yellow here, but they set up together, you can just tell this wasn't in contact with the tissue because of these folds that you see here. So even if you had just done this little bit of yellow and then seated this tray all the way down against that ridge, these two materials would be indistinguishable from each other except for the color. And so when you see those together where it looks like it's all pink and then it just happens to be yellow here and it's all one impression instead of what we have here where it looks like a dry lake bed with some more impression material on top of it, you can still get a successful restoration. So because of a lot of these factors, that's why we're going to need to ask for a new impression. It just reminded me of that show Chopped. I don't know if you guys watch that cooking show Chopped, but they'll always say, because of these factors, that's why we had to chop you. And so, yeah, this impression probably does need to be chopped. And I know the dentist can do a little bit better. I don't know if they were rushed, but you can see the void right along here as well. You know, over here, it actually turned out pretty good. We've got a nice impression around the buccal, lingual, and occlusal surfaces of all those teeth. So with another chance to go in there and do that, hopefully we'll be able to capture this well. The dentist could even go ahead and could adjust that opposing tooth before the impression is taken, so we could deal with that now in the laboratory and not have to do that when the bridge is actually seated. So it just caught my eye as I walked by, and usually when you see a bridge impression, you will see the same colored material go from prep to prep, and when I saw this hole in the middle, I thought that's an interesting place to not have enough syringe material, and you really have to be trying to minimize how little syringe material you're going to use here, which is fine, again, in a simultaneous impression. But if you're going to do a two-step impression like this, we need a lot more. And frankly, we'd like to see the rest of this maybe hollowed out a little bit with some more syringe material around there as well. So the preps themselves look really good. I've got no issues with the preps themselves. When we adjust that opposing, we'll get a little extra space for the Bruxer bridge over here, but a new impression will go a long way to making this case something that's going to be successful for the doctor. And
now let's go to a segment we call Viewer Mail. This week's viewer mail comes to us from, and I'm going to stop and apologize first. I hope I don't butcher your last name, but I believe it's Dr. Marina Emilenchik, and she writes to us and says, "Hello, Dr. Detola. I'm an orthodontist, and I need to find out an effective way to bond my brackets to your zirconia crowns. I did the steps as if it was a porcelain crown, hydrofluoric acid and silane, but it has been a complete and very frustrated failure. Is there any other way or other materials available to do it with? Thank you."
Oh, well, that's a great question, Marina. And that's actually something we hadn't anticipated, was orthodontists having to be able to put brackets onto somebody's tooth who had an all zirconia crown, but I'm glad you brought it up. Marina, this has been something that we've discussed many times on the show, but mainly in regards to dentists wanting to cement a full contour zirconia crown, like a Bruxer crown, onto a short tooth, and it keeps falling off. So they're essentially experiencing the same kind of adhesive failure that you are. And so we've spent a lot of time over the last year and a half investigating the best way to be able to do this. And you did exactly what just about all of us did in the beginning, and that was tried to treat this new type of all ceramic crown as though it were a traditional all ceramic crown. And so you hit it with some hydrofluoric acid. Now, when you hit a typical ceramic material with hydrofluoric acid, it removes some of the glassy matrix that's there and creates some micromechanical undercuts to help the bonding. But there's no glass in this material. It's 100% zirconia oxide. And so essentially when you put hydrofluoric acid on it, it just laughs at the acid and it says, "Nice try," and you rinse it off. You can leave it on for 5 minutes, 10 minutes, 5 months. It doesn't matter. It won't do anything. It will not alter it at all. And so that doesn't work. And then traditional silanes don't work on this material as well. So you do need some different materials, as you alluded to. Now, the only thing I don't know from your question is whether this is an anterior tooth or a posterior tooth. I'm going to guess it's somewhere around a bicuspid, just because we don't have a lot of dentists who are using these solid zirconia crowns for, say, teeth 7 through 10, although we do have some that are. And if it was a posterior tooth, I'm guessing you would have banded it perhaps instead of bracketing it. So maybe it is a bicuspid, so it's not necessarily in the aesthetic zone or right in the front. But even if it was, it's the same steps, but you just might need to be a little more careful. So very quickly, one of the interesting things that happens to zirconia oxide is that it gets contaminated by saliva. So the first thing you need to do in this bonding procedure is to decontaminate this zirconia crown. There's two ways to do this. One is by sandblasting it, which is going to be a little difficult for you because I'm assuming the crown's already in the patient's mouth and you may or may not have an intraoral sandblaster. And the second alternative method is to use something called IvoClean from Ivoclar Vivadent. It's a little purple liquid. Comes in a little bottle, and you're going to put this onto the tooth with a micro brush or a cotton pellet and leave it on for 30 seconds and rinse it off. That's going to get all the salivary phosphates that are in the saliva off of that and decontaminate that tooth. And so once we get all those salivary phosphates that are bound to the zirconia oxide off of there with the IvoClean, we're going to replace those with some desirable phosphates, because it turns out that phosphate groups are about the only thing that will interact with zirconia oxide and actually form a bond. And so the desirable phosphates that we're going to want to use is a product by the name of Z Prime Plus from Bisco. And so that's going to come in a separate little bottle as well. So now you've purchased the IvoClean, or you've gotten it from your general dentist, your referral source maybe, or just buy it, if you want to, through your dealer. Little bottle of IvoClean, 30 seconds, rinse it off, and now we're going to place the Z Prime Plus onto that same spot where you went in and placed the IvoClean and rinsed it off. Just do it on the whole crown and put the Z Prime Plus there, leave it there for about 30 seconds, and then air dry it. And then I would put a second coat on for about 30 seconds and air dry it as well. And so now we've got a two-ended molecule that's bonded to that crown. We've got the hydrophilic end, the phosphate end, that's now bonded to the zirconia, and we have a hydrophobic end that's sticking up, of course, that you can't see, but the hydrophobic end will bond to resin. So at this point, you can use any resin that you want. I'm sure there's resin in the cement you want to use. You can put a bonding agent on it first and light cure it if you want to. or perhaps you use a self-cure or something like that. So this is actually how we bond these crowns into place, and this is how we're going to want to bond a ceramic or a metal bracket to a zirconia crown with the use of the Ivoclean and the Z Prime Plus. And then you're just going to have to take it off when it's all done, and I've never done that before, and so I have no idea what's going to happen when you go to take that off, unfortunately. But that's going to be, 18 months, probably 2 years down the road when it comes time to take off this bracket. I would assume, though, the way we struggle with bonding zirconia into place, that it'll probably come off hopefully a little easier than we think when you go to remove that bracket. If it's a metal one, hopefully we get some deformation when you squeeze it. And I want you to, be able to squeeze it and pull it off. I tell you what, we're going to send something along. If Megan decides you're the viewer mail of the week, I'll send something along that's going to make this process a little bit easier, regardless of how you want to get it off. But thank you, Marina, for being an orthodontist and letting us know that you had this concern. We never anticipated that, and hopefully this will be able to spread out to some other orthodontists who find themselves having to bond to these all zirconia crowns, because it's the same way that it was a new issue for dentists to figure out how to put these on. Orthodontists are going to have to figure out how to bond to them too.
Definitely.
And so,
well, you know how when you're watching a really good TV show and it's like right at this dramatic moment and then they do a commercial break?
Like on Suits?
Like on Suits, my
Right.
favorite show ever. Yes, that's going to happen right now. So before I announce whether she wins the prize or
Okay.
not, I've got something for you so that the viewers can watch it, and then we'll just wait.
Okay, sounds great.
I was not paid by Earth Balance to talk about this product, but I have to because it is the best. And if Earth
Really?
Balance,
Because it sure seems like you were paid to talk about this product right about now.
oh goodness, well I'm not, and I wish I was. But hey, if Earth Balance wants to start sending me product, I would be more than happy. We'll give you our address. No, but really, this is coconut and peanut butter spread, all natural. They don't use genetically modified peanuts. And I know that you are a crazy fan of peanut butter
I am.
and coconut. So this is...
And Perrier, if you're
Right.
listening, Nestle.
This is the best thing
So
you
good.
could ever have.
Oh, that's where this is heading.
This is exactly where it's going. Okay, come on. Do you want some?
I want you to do the airplane
Okay,
thing.
nope. Come on.
I want the airplane to come in for a landing.
Get
We-
it? It's going to be a while, folks. We've had trouble in the past with... You want more? Oh, keep talking because you need it. Yeah, absolutely delicious. Oh, yeah, spread it out. And what's so good about it, honestly, are you okay? Okay. Is that it's just peanuts and then organic coconut oil. Throw it back. All right. And then agave syrup and salt. And it is so good. Oh, gosh, put it
Wow.
on toast. How good is that?
It's it starts off very peanut buttery, but then it ends on kind of a classic coconut note. It's
Yeah.
bold without being assertive, and that's what I like. It's that's really good.
Do you know, I just had a total brilliant idea, light bulb moment. What if I made cookies out of that?
Wow,
Are you kidding?
I can only dare to dream.
Right. Okay.
You've been
so,
reading my diary?
No, that would be very, very strange and probably a little disconcerting. Okay, so now we've got built up the momentum. Yes, Marina, you are the winner, and guess
Wow.
what we've got? For your orthodontic practice, you can hang this on the wall, a beautiful clock featuring who else?
Marina's looking at it going, what the hell? What the hell is that clock? Because she's never seen the show before. Well, Marina, our gifts have kind of, we've stepped them up a little bit. I mean,
Yes.
It used to be just little golf tees and pendants and then little explosive devices. And now we've got something that's really, really useful, and we have a clock. You may want to keep this in your personal office. But we're happy to be able to send this out to you along with a Bruxer adjustment and polishing kit. And Marina, the reason you're going to need this is once you get that bracket off, hopefully there'll still be a little resin cement stuck to the crown itself. I have to swallow every 4 words, thanks to Megan.
This is going to be interesting.
And
for the
this is
rest
how
of
you're
the
going to
show.
polish that restoration and get it back to its high shine. It doesn't matter that you break the glaze off of it. The particle size is so small on these zirconia oxide crowns that you'll be able to polish it with these wheels and get a nice high shine back on it as well. But I'm dying to hear what happens. So please keep us involved. Send us an email. Let us know if you're able to get that bracket on to stay on the tooth. And I want to hear about it when it comes off as well. So this is now part of that prize
Yes,
as well.
and one more. if the clock wasn't enough, she is now a photo of me presenting the clock.
That is nice. I like the look on your face. I like this one better. Did you see the other one?
No, what is that? Oh, just total.
This is a look of total disgust.
It is.
On your part.
It frequently happens on
Pretty
Chairside
typical.
Live.
I'm
right.
not sure what I might have said to you to rankle you and disgust you, but
Probably don't want to know.
I'm probably proud of it. It probably wasn't anything as bad as my grandfather drowns cats. So let's
Listen.
Which one do you think Marina would enjoy?
I don't know. I think she might like the smiley regular one.
I think so. Let's do that. We'll save this for one of our more cynical viewers.
And here, because we know you wanted our autograph, right?
That's right.
Who doesn't?
Even though she hasn't seen the show before.
She's going to be an instant fan.
And this can be sold, by the way, on eBay, Marina, if you enjoy money more than flimsy one-off photographs.
That quarter
All right,
will
so thanks
really go
again for that
far.
letter, Marina. We really appreciate that. We have any news today?
We do. A 92-year-old man left the dentist office with a bad feeling in the pit of his stomach. Literally. Apparently, the dentist advised him to get an x-ray after the appointment, and writhing in pain, he did just that. What they found? An implant driver in his stomach, causing unbelievable pain. Doctors removed the instrument and the patient filed a lawsuit against the dentist. The dentist has been licensed to practice dentistry since 1979 and says she has never had any disciplinary action taken against her.
Well, there's always a first time.
Right.
I mean, I get that you haven't had any disciplinary action taken against you, and that's wonderful. But when a patient swallows an implant driver, you know what those look like, those little, an implant screwdriver. I mean, that's pretty amazing. How did they find out that the patient had swallowed this?
She told him right after the appointment that you need to go get an x-ray. So I think she knew it happened. And I mean, it was kind of that point of no return. Whoop, down it goes. And she couldn't retrieve it then and there. So, and he was in unbelievable pain, as you could imagine. And so they did an x-ray and CAT scan and did the whole thing and were able, of course, to get it out. But I couldn't imagine. Oh, that would be absolutely just horrific.
Yeah, we're supposed to, in dentistry, there's a lot of things we do with little rubber dam clamps and things like that, where you're supposed to tie dental floss to it. And this is one of those things where I've seen implant doctors actually tie things. There's like a little hole in it to tie dental floss to it in case it starts to go down so you can pull it back out again. So unfortunately, it does kind of sound like, without knowing all the facts, it does sound like it might be a case of malpractice. But this is why we have malpractice insurance, in case things like this happen. But the bigger lesson is you just got to be honest with patients. And if you have an 80, 90-year-old guy swallow something, you got to say, you swallowed something. Let's get you to the hospital before you lay around in pain for a week. Because now the families really want to come after you if something like that happens. Anything else?
Yes. An illegal dental clinic in British Columbia was recently shut down after a raid exposed the criminal operation. Dr. David Wu was not licensed to practice, but was operating a dental clinic out of his home. An alert was sent out to about 1,500 patients, as they may have been exposed to hepatitis and HIV through improperly sterilized instruments and no evidence of any source for sterilized water. Apparently, the space was filthy: a dirty floor, visible mold, shelves covered with dust and debris. He stuffed dental supplies into closets and around the room, and Post-it notes cluttered the wall. There was even an old sterilizer unplugged and covered in dust. According to the record, he was ordered to stop his underground practice 10 years ago.
Wow. Well, this is a sad story because, at Glidewell, we hate to lose a good client. And he paid all his bills on time for his at-home dentistry. And
No.
It's actually tough shipping things back and forth between Canada. He was not one of our clients, but 1,500 patients is a pretty successful practice.
I mean, and for 10 years he's kept this thing going on strong?
I mean, it's impressive to me. And he had a sterilizer. Okay, it wasn't plugged in. It was covered in dust. They don't work as well that way. They need to be plugged in and actually in working order.
Here's my question. There had to be a moment. There had to be a moment when the patients, and I pray that they didn't go to him because it was, a money issue, but I would assume that it probably was, right? He was cheaper, I'd assume, than going to an actual practice.
Right.
But there had to be a moment. I believe that it would be when you walked in the house or when you made the appointment and found out the address. But you walk into the house and you see all the dirt, you see all the clutter. You're in his bedroom. The waiting room is his living room. Is there not a moment in time where you stop and think, this is probably a bad idea?
But what if you're grandfather, for example,
oh no,
had told you this guy is the best dentist, and it's a little weird. He works out of his house. He used to work out of his van, but he's upgraded. Now he's out of his house. It's a little dirty. Not the cleanest guy. You're going to see a lot of Post-it notes all over the walls, but at least he's organized. But he does really good dentistry. And he's actually pretty painless. I mean, you could see how maybe somebody would be talked into it.
Maybe in Canada.
Oh, how dare you.
Sorry,
how
I know,
dare
I
you.
know your love for Canada. I
I've
apologize.
got a total country crush on Canada.
I know
and
you
go
do,
there
and
on
I
vacation.
retract that statement. But yes, I could see how it could happen, but it's just, never.
It's people with next to no money.
Which is so sad. And, and actually what's interesting is there is the real Dr. David Wu, who is practicing there in Canada, and he was super upset because his name was essentially getting, taken through the mud because of this Dr. David Wu, and so he was trying to clear his name and his reputation because it had been dirtied up by this illegal dentist. So it's just a whole debacle, but I don't know.
It's funny to hear something like that because you don't know which Wu you're going to end up going to, and you can imagine. I mean, it's one of those things that sounds bad, but if there was another dentist named Michael DeTola who was doing horrible dentistry out of the back of an RV, you think about it when it applies to yourself, and you go, that is really awful. And there's some unfortunate people whose names get associated with other people's names, and especially it'd be one thing if there was just a serial killer named David Wu, and then you go, oh, your name's David Wu. Well, ha ha ha, are you this? You're not, but when it's another dentist who's doing really bad dentistry, and then splashed across the headlines, David Wu is a filthy, non-sterilizing dentist working out of his house. That's probably not good for the other Dr. Wu.
And I think the real Dr. Wu, the licensed one, is retired, but I guess he had patients, or former patients, I should say, calling him, writing to him, saying, what happened? You were such a great guy. Like, I can't believe you would do this. And so he had to, there's that fruit flag. And he had to write to them and try to clear up his name. And so it's an unfortunate circumstance. And luckily, I don't know anyone who named Megan Strong who co-hosts another dental talk show, that they're really, doing horrible things. So I think I'm clear.
I think you are. I went to school with a Dr. Payne.
Wow.
Payne.
That's unfortunate.
Well, I think people would still come see him. If it was Pain, that might be a little different. Unless he was French Canadian, Dr. Pond, Dr. Bread. All right, that'll about wrap it up for this edition of Chairside Live. On behalf of myself and Megan and everybody here at the laboratory, I want to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time. When my mom was growing up, if they had, because they had a bunch of dogs and whatever, and a horse and cows and blah, blah, blah. And if, one of their dogs got pregnant, or the kitten, the cat had kittens, or the dog had puppies, if they didn't want them, so he would put them in a gunny sack with, a brick or whatever, and throw them into the water.
Do you hear muffled kittens' meows when you go to sleep every night?
That's so messed up. Stop. I should never.
You're like the
told you.
Winchester Mystery House where the lady had to keep building.
Where is this kitten lake of souls?
Where are these bones? Wouldn't that be hilarious if every time you thought you had a fish on, you pulled it up, it was a dead kitten?